Abortion access, fertility, population policy, and immigration, intersections in demographic and political strategy. Introduction. The intersection of abortion access, fertility rates, population growth or decline, and immigration policy has become a defining axis of contemporary political, demographic, and cultural debate. In the United States and globally, declining fertility rates and aging populations have prompted governments and political actors to reconsider the levers available for shaping demographic futures. Abortion policy, once primarily framed as a matter of individual rights, health, or morality, is increasingly entangled with broader strategies for managing national birth rates, labor force sustainability, and cultural identity. Immigration, meanwhile, is positioned both as a solution to demographic decline and as a flashpoint in debates over national composition and sovereignty. This report provides a comprehensive analysis of how abortion access is framed and leveraged within demographic and political debates, with a focus on the United States and international comparisons, notably Hungary and Japan. It examines the narratives and policy instruments employed by different political, ideological, and demographic groups, the measurable impacts of abortion policy on fertility and population trends, and the ways in which abortion and immigration policies are used to influence labor force dynamics and cultural identity. The report also explores the consequences for marginalized groups, the legal complexities arising from jurisdictional disputes, including tribal nations, and the evolving landscape of public opinion and advocacy. Framing abortion access in demographic and political debates. The shifting terrain, from individual rights to demographic strategy. Historically, abortion debates in the United States and much of the industrialized world have centered on questions of individual liberty, bodily autonomy, and moral or religious values. The pro-choice movement has emphasized privacy, self-determination, and gender equality, while opponents have invoked the sanctity of life, traditional family structures, and religious doctrine. However, as fertility rates have declined and population aging has accelerated, abortion access is increasingly discussed in terms of its implications for national birth rates, economic sustainability, and cultural continuity. This shift is evident in the rhetoric of political leaders, think tanks, and media commentators. In the United States, prominent right-wing figures such as Donald Trump and Elon Musk have explicitly linked abortion restrictions to the goal of increasing native-born births, framing demographic decline as a threat to national vitality and identity. The Heritage Foundation's Project 2025 Policy Blueprint, for example, positions abortion not only as a moral issue, but as a lever for restoring traditional family structures and countering what it describes as civilizational sewer. Slide. Internationally, Hungary's government under Viktor Orban has made pronatalist policy and abortion restrictions central to its demographic strategy, explicitly rejecting immigration as a solution to population decline and instead seeking to boost native Hungarian births. Ideological and demographic group narratives. The framing of abortion access in relation to fertility and population policy varies sharply across political, religious, and demographic lines. In the United States, conservative and religious groups often present abortion as a driver of demographic decline, linking it to anxieties about the replacement of native-born, often implicitly white, populations by immigrants or minorities. This narrative draws on long-standing themes of pronatalism, eugenics, and racialized fears of cultural displacement. The Great Replacement theory, for instance, has been invoked by some anti-abortion activists to argue that abortion and immigration together threaten the continuity of the nation's core identity. By contrast, progressive and feminist groups continue to foreground abortion as a matter of individual rights and health equity, but also increasingly highlight the disproportionate impact of abortion restrictions on marginalized communities, including immigrants, people of color, and those with low incomes. These groups argue that attempts to use abortion policy as a demographic lever often reinforce existing inequalities and undermine reproductive justice. Demographic factors such as age, education, income, and race also shape attitudes and political mobilization around abortion. Surveys consistently show that younger, more educated, and racially diverse populations are more supportive of abortion access, while opposition is strongest among older, white, evangelical, and conservative groups. Abortion policy impacts on fertility and birth rates, U.S. Evidence. Recent trends in U.S. fertility and abortion policy. The United States, like many developed countries, is experiencing sustained declines in fertility. The total fertility rate, TFR, has fallen below the replacement level of 2.1 children per woman, reaching 1.6 in 2025 and projected to remain at or below this level for decades. This trend is driven by a combination of delayed marriage and childbearing, economic uncertainty, rising educational attainment especially among women, and increased access to contraception. The Supreme Court's 2022 Dobbs v. Jackson Women's Health Organization decision, which overturned Roe v. Wade. Wade returned authority over abortion regulation to the states. Since then, 21 states have enacted bans or severe restrictions on abortion, while others have moved to protect or expand access. This has created a patchwork of legal regimes, with significant interstate variation in access, enforcement, and health outcomes. Empirical evidence, abortion bans and birth rates. Multiple recent studies provide robust evidence that abortion bans are associated with measurable increases in birth rates, particularly among disadvantaged populations and in states with poor maternal and child health outcomes. A landmark study published in JAMA in 2025 found that in the 14 states that implemented complete or 6-week abortion bans between 2021 and 2023, the fertility rate increased by 1.7% above expectation, equivalent to 22,180 excess births. The largest increases were observed among racially minoritized individuals, approximately 2.0% increase, unmarried individuals, 1.8%, individuals younger than 35 years, approximately 2%, Medicaid beneficiaries, 2.4%. Those without college degrees, 2.4% for high school diploma, 1.6% for some college. State-level differences were pronounced, with Texas experiencing a 2.3% increase, followed by Kentucky, 1.4%, and Mississippi, 1.4%. Southern states saw roughly double the increase compared to non-Southern band. Image. The increase in births was not uniform across all groups. The largest effects were among those facing the greatest structural disadvantages, people of color, those with lower educational attainment, and Medicaid recipients. This pattern reflects both higher pre-ban abortion rates in these groups and greater barriers to traveling out of state or accessing medication abortion. The 1 in 4 statistic is a lifetime risk estimate, probability that a woman will ever have an abortion by age 45, while the 11.2 per 1,000 figure is an annual rate. How many abortions occur among women aged 15 to 44 in a single year? They measure different things, which is why they look so different. Breaking down the two statistics. Lifetime risk, 1 in 4. This comes from research by the Guttmacher Institute, which estimates that about 25% of U.S. women will have an abortion by age 45 health day. It's a cumulative probability. Across her reproductive years, a woman has about a 1 in 4 chance of ever having the procedure. This accounts for the fact that some women may have more than one abortion, while others may have none. Annual abortion rate, 11.2 per 1,000 in 2022. Reported by the CDC in 2022, the U.S. Abortion rate was 11.2 abortions per 1,000 women aged 15 to 44 CDC. This is a snapshot of 1 year. It tells us how common abortion was in that year among women of reproductive age. For context, that equals about 1.1% of women aged 15 to 44 having an abortion in 2022. Why they differ. Different time frames. The annual rate is short-term, 1 year. The lifetime risk is long-term, over 30 years of reproductive life. Accumulation effect. Even if the annual rate looks small, around 1%, when you add that risk across decades, it accumulates into a much larger lifetime probability. Example. If the rate stayed around 1% per year, over 30 years the cumulative risk would approach 25 to 30%, which matches the 1 in 4 estimate. Population versus individual perspective. Annual rate equals population-level measure of frequency in a given year. Lifetime risk equals individual-level probability across her reproductive lifespan. Countervailing trends and limitations. Despite these increases, the overall U.S. fertility rate has not rebounded to replacement levels. Experts note that while abortion bans have led to less decline in fertility in banned states, they have not produced a major rise in national birth rates, in part because many people still access abortion in other states or via telemedicine. There is also evidence that some individuals in banned states are choosing to delay or forego pregnancy altogether due to the risks and uncertainties associated with restricted reproductive care. Abortion policy impacts on labor force and the economy. Workforce participation and economic growth. Abortion access is closely linked to women's participation in the labor force, earnings, and broader economic outcomes. Restrictions on abortion reduce women's ability to control the timing and circumstances of childbearing, which in turn limits educational attainment, career advancement, and economic mobility. Recent analyses estimate that the 16 states with the most restrictive abortion policies cost the U.S. economy over $64 billion annually in lost GDP, with the total rising to $133 billion when including all restrictive policies. These losses are driven by reduced labor force participation among women ages 15 to 44, over 556,000 fewer women in the workforce annually. Lower earnings for working women, 8.5% average loss, with Black women experiencing a 9.6% loss. Difficulty attracting and retaining talent in banned states, leading to business relocation and maternity deserts, areas with no obstetric care. Source: IWPR 2024 to 2025. The negative economic effects are most pronounced for Black and Latina women, who already face systemic barriers to employment and earnings. If abortion restrictions were lifted, labor force gains would be 1.4% among Black and Latina women compared to 1.1% for white women. Labor force sustainability and demographic aging. The decline in U.S. fertility rates, coupled with population aging, is projected to reduce the worker-to-retiree ratio from 3.0 today to 2.0 by 2075. This shift threatens the sustainability of social welfare programs and economic growth. While some policymakers argue that restricting abortion will boost native-born births, and thus the future labor force, the evidence suggests that such policies have only marginal effects on overall fertility and may actually reduce women's current workforce participation, exacerbating labor shortages. Immigration policy and demographic strategy. Immigration as a demographic solution. With fertility rates below replacement in the United States and much of the developed world, immigration has become the primary driver of population growth and labor force sustainability. In 2023, for the first time, immigration accounted for the entirety of U.S. population growth, as the native-born population declined due to low birth rates. Immigrants now represent 14.3% of the U.S. population, the highest share ever recorded, and are projected to account for all future labor force growth. Not a Great Source Migration Policy Institute 2025. Immigrants and their U.S.-born children are projected to account for all future labor force growth, a finding with major implications for economic policy and social cohesion. Without immigration, the United States population would already be shrinking, and the worker-retiree ratio would decline even more rapidly. Political and ideological contestation. Despite the demographic necessity of immigration, it remains a deeply contested issue. Some political actors, especially on the right, frame immigration as a threat to national identity and cultural cohesion, advocating for policies that prioritize native-born births over reliance on newcomers. This is particularly evident in Hungary, where the government has explicitly rejected immigration as a solution to population decline, instead promoting pronatalist policies and abortion restrictions to boost native births. In the United States, debates over immigration and abortion are increasingly intertwined. The Great Replacement theory, which posits that elites are intentionally replacing white Christian populations with non-European immigrants, has been invoked to justify both anti-immigration and anti-abortion policies. Conversely, progressive groups argue that immigration is essential for economic vitality and that abortion restrictions disproportionately harm immigrant and minority communities. Abortion policy as a lever in pronatalist strategies. The case of Hungary. Hungary's pronatalist turn. Hungary offers a paradigmatic example of using abortion policy as part of a broader pronatalist demographic strategy. Facing a declining population and low fertility rates, total fertility rate of 1.56 in 2025, the Orbán government has implemented a suite of policies designed to encourage native births and reduce reliance on immigration. These include lifetime tax exemptions for mothers with 4 or more children, housing subsidies and baby loans for families who commit to having children, mandatory counseling and fetal heartbeat requirements for abortion seekers, restrictions on access to contraception and family planning services, aggressive promotion of traditional family values and exclusion of LGBTQ+ families. Hungary spends 5 to 6% of GDP on family-oriented incentives, among the highest in Europe. The government frames motherhood as a patriotic duty and links national survival to the fertility of Hungarian women. Outcomes and critiques. Since 2010, Hungary's fertility rate has risen from 1.25 to 1.56, and the number of abortions has declined from 80,000 in 1980 to under 24,000 in 2020. However, the total fertility rate remains well below replacement, and critics argue that the policies disproportionately benefit middle and upper-class families, reinforce gender inequality, and restrict reproductive freedoms, especially for minorities and LGBTQ+ individuals. The government's approach is explicitly anti-immigration, with Orbán and his allies invoking the Great Replacement theory to justify both pronatalism and border restrictions. International observers warn that Hungary's model erodes reproductive rights and serves as a cautionary tale about the dangers of using abortion policy as a tool of demographic engineering. Abortion policy in low fertility contexts. Japan. Japan's demographic crisis. Japan exemplifies the challenges of managing population decline in a low fertility, aging society. The TFR fell to 1.20 in 2023, with the number of births dropping below 800,000 for the first time. The population is projected to decline to 87 million by 2070, with nearly 30% already over age 65. Key drivers of low fertility in Japan include economic insecurity and precarious employment, high costs of housing and education, delayed marriage and childbearing, insufficient childcare infrastructure and long working hours, persistent gender inequality in household labor and parental leave, policy responses, and the role of abortion. Japan has implemented a range of pronatalist policies, including expanded parental leave, childcare subsidies, and efforts to encourage male participation in child rearing. However, abortion remains legal and relatively accessible up to 22 weeks, though social stigma and bureaucratic hurdles persist. Unlike Hungary, Japan has not sought to restrict abortion as a lever for boosting fertility. Instead, policy debates focus on improving work-life balance, supporting families, and cautiously expanding immigration to address labor shortages. Nonetheless, the government faces significant challenges in reversing demographic decline, and the experience of Japan underscores the limited effectiveness of pronatalist policies in the absence of broader social and economic reforms. International comparisons: abortion law, fertility, and immigration. Global trends in abortion law and fertility. Over the past 50 years, there has been a global trend toward the liberalization of abortion laws, particularly in industrialized countries. Liberal abortion laws are associated with lower abortion rates, improved maternal health, and reduced maternal mortality. In countries with severe restrictions, abortion rates have actually increased, and unsafe procedures contribute to 5 to 13% of maternal deaths worldwide. Countries such as France have enshrined abortion rights in their constitutions, while others like Poland, Honduras, and El Salvador have imposed near-total bans. China, after decades of promoting abortion under the one-child policy, is now seeking to reduce non-medically necessary abortions as part of its pronatalist turn. Comparative table: fertility, abortion law, and immigration policy. Political and ideological narratives, linking abortion to cultural identity. The U.S. Context: culture wars and demographic anxiety. In the United States, abortion access is deeply entangled with debates over cultural identity, national destiny, and the meaning of citizenship. Conservative and religious groups frame abortion as both a moral crisis and a symptom of broader social decay, linking it to the dissolution of the traditional family, gender roles, and national strength. The rhetoric of saving civilization and restoring moral sanity is often accompanied by explicit or implicit references to race, with declining white birth rates and rising immigration presented as existential threats. The anti-abortion movement has successfully mobilized these anxieties to drive political action, including single-issue voting, legislative campaigns, and judicial appointments. The Heritage Foundation's Project 2025 and similar initiatives seek to institutionalize these values at the federal level, proposing sweeping restrictions on abortion, contraception, and gender-affirming care, and redefining federal agencies to promote the life and health of women and their unborn children. Progressive and pro-choice groups, meanwhile, emphasize the importance of reproductive autonomy for gender equality, economic opportunity, and social justice. They highlight the disproportionate impact of abortion restrictions on marginalized groups and the dangers of using reproductive policy as a tool of demographic engineering. International narratives. In Hungary and other parts of Central and Eastern Europe, pronatalist and anti-abortion policies are explicitly linked to nationalist and anti-immigrant narratives. The government frames motherhood as a patriotic duty and positions itself as a bulwark against Western decadence and demographic decline. LGBTQ+ rights are also targeted as threats to the natural family and national survival. In Japan, the debate is less overtly ideological but still shaped by concerns about national identity, economic vitality, and the sustainability of the welfare state. Immigration remains a sensitive topic, with policymakers balancing the need for labor with anxieties about cultural change. Impact on marginalized groups and immigrants. Disproportionate burdens. Abortion restrictions in the United States and elsewhere disproportionately harm marginalized groups, including immigrants, people of color, low-income individuals, and those living in rural or medically underserved areas. These populations face greater barriers to accessing care, including lack of health insurance. 50% of undocumented immigrants are uninsured. Fear of detention or deportation when traveling to seek care. Geographic isolation and maternity deserts. Language barriers and lack of culturally competent providers. Increased risk of criminalization and surveillance. For immigrants, especially those who are undocumented or in mixed-status families, the intersection of abortion bans and immigration enforcement creates de facto internal borders that curtail reproductive freedoms and mobility. Customs and border protection checkpoints, state-level anti-immigrant laws, and agreements between local law enforcement and ICE make it dangerous or impossible for many to travel to states with abortion access. Health outcomes, maternal and infant mortality. The health consequences of abortion restrictions are severe. Studies show that maternal mortality rates are nearly twice as high in states with abortion bans compared to supportive states, with Black mothers facing a risk more than 3 times that of white mothers. Infant mortality has also risen in banned states, with Black infants experiencing an 11% higher death rate than expected. Table 5. Maternal and infant mortality in states with and without abortion. Bans 2023. Legal strategies and jurisdictional issues. Tribal nations and states. Tribal sovereignty and abortion access. The Dobbs decision has prompted renewed discussion of the potential for tribal nations to serve as safe harbors for abortion access, given their status as sovereign entities within the United States. However, the legal and practical realities are complex. Tribal authority to provide abortion care is constrained by federal and state laws, funding limitations, and internal governance. The Indian Health Service, which serves many Native communities, is subject to the Hyde Amendment and provides abortion only in limited circumstances. Tribal governments are also divided on the issue, with some reluctant to challenge state or federal authorities or to prioritize abortion access amid other pressing health disparities. Native women already face some of the highest rates of maternal mortality and violence, and the legacy of reproductive coercion and child removal continues to shape policy and advocacy. State shield laws and cross-border access. In response to the proliferation of abortion bans, 22 states and the District of Columbia have enacted shield laws to protect providers and patients from out-of-state prosecution or civil liability. These laws are designed to facilitate telehealth abortion, protect medical information, and prevent extradition. However, their effectiveness is limited by federal law and ongoing legal challenges, and they do not address the barriers faced by immigrants and others who cannot safely travel. Policy instruments used to influence population composition. Pronatalist incentives and selective policies. Governments seeking to influence population composition employ a range of policy instruments, including tax exemptions and financial incentives for large families in Hungary, housing subsidies and baby loans in Hungary and Quebec, mandatory counseling and waiting periods for abortion in Hungary and some U.S. states, restrictions on access to contraception and family planning in Hungary and parts of the United States, selective pronatalism, targeting middle and upper-class families in Hungary, exclusion of LGBTQ+ families and single parents from benefits in Hungary, immigration restrictions and border enforcement in Hungary, Japan, and the United States. These policies often reinforce existing social hierarchies and exclude marginalized groups from the benefits of pronatalist programs. U.S. State-level variation. In the United States, states vary widely in their approach to fertility, abortion, and family policy. Some have expanded Medicaid coverage for maternal health, doula and midwifery care, and fertility preservation, while others have imposed severe restrictions on abortion and limited public funding for reproductive health. The result is a fragmented landscape in which access to care and demographic outcomes are increasingly determined by geography and political control. Public opinion and electoral politics. Linking abortion and demographics. National and state-level attitudes. Public opinion in the United States remains broadly supportive of legal abortion, with 63 to 64% of adults saying it should be legal in all or most cases. Support is highest among younger, more educated, and racially diverse populations, and among Democrats and religiously unaffiliated individuals. However, there is significant variation by state, with majorities in some southern and Midwestern states favoring restrictions. Polling also shows that most Americans prefer improving conditions for parenthood, such as paid leave, childcare, and health care, over criminalizing abortion, and are wary of government overreach into reproductive decisions. Even among Trump voters, a majority support keeping the government out of abortion decisions and oppose using the Comstock Act to ban abortion nationwide. Electoral implications. Abortion has become a salient electoral issue, with voters increasingly likely to support pro-choice candidates and to oppose efforts to restrict access. Ballot measures in several states have affirmed abortion rights, even in conservative regions. However, the issue remains polarizing, and anti-abortion groups continue to mobilize around narratives of demographic decline and cultural threat. Media and elite discourse. Think tanks, politicians, and influencers. The framing of abortion, fertility, and immigration in elite discourse reflects and shapes public attitudes and policy. Conservative think tanks such as the Heritage Foundation, National Right to Life Committee, and Hungarian Conservative promote narratives linking abortion to national decline, cultural crisis, and the need for demographic renewal. Media outlets and influencers amplify these messages, often invoking apocalyptic or martial metaphors, cultural war, civilizational suicide, replacement. Progressive organizations and academic journals counter with evidence-based analyses of health outcomes, economic impacts, and human rights, emphasizing the dangers of using reproductive policy as a tool of social engineering and the importance of intersectional advocacy. Health outcomes, maternal, infant mortality, and child welfare. Maternal and infant mortality. Abortion bans are associated with significant increases in maternal and infant mortality, especially among Black women and infants. In Texas, maternal mortality rose 56% in the first year of the state's abortion ban, with white mothers experiencing a 95% increase. Black mothers in banned states are more than 3 times as likely to die as white mothers, and black infant mortality is 11% higher than expected. Supportive states, by contrast, have seen declines in maternal mortality and better health outcomes, reflecting the importance of comprehensive reproductive care, Medicaid expansion, and social support. Child welfare. The increase in births among disadvantaged populations in banned states raises concerns about child welfare, as these states often have the weakest social services and highest rates of poverty, uninsured residents, and adverse health outcomes. The lack of support for new parents, combined with punitive approaches to reproductive policy, risks deepening existing inequalities and undermining the well-being of children and families. Advocacy, counter-strategies, and policy responses. Progressive and reproductive justice advocacy. Advocacy groups are responding to the new landscape with a range of strategies, including litigation to challenge restrictive laws and defend shield protections, expansion of abortion funds and practical support networks, efforts to improve Medicaid coverage for maternal and reproductive health, intersectional organizing linking abortion rights to immigrant justice, racial equity, and LGBTQ+ rights, public education campaigns to counter misinformation and stigma. Reproductive justice frameworks emphasize the right to have children, not have children, and parent with dignity, recognizing the compounded vulnerabilities of marginalized groups. Conservative and pro-natalist counter-strategies. Anti-abortion and pro-natalist groups continue to pursue legislative and judicial strategies to restrict abortion, limit contraception, and promote traditional family structures. Project 2025 and similar initiatives propose sweeping federal action to ban medication abortion, enforce the Comstock Act, and redefine federal agencies to prioritize the life and health of women and their unborn children. Internationally, alliances between conservative governments, think tanks, and influencers seek to export these models and shape global norms around reproductive rights and demographic policy. Conclusion. The entanglement of abortion access with debates over fertility, population growth or decline, and immigration policy reflects a profound shift in the politics of reproduction. Abortion policy is no longer solely a matter of individual rights or health, but a lever in broader demographic strategy used to encourage higher native birth rates, reduce reliance on immigration, and assert control over population composition. The consequences of these strategies are far-reaching, affecting not only birth rates and labor force dynamics, but also health outcomes, economic opportunity, and the fabric of cultural identity. International comparisons reveal the limits of pronatalist and restrictive abortion policies in reversing demographic decline and highlight the importance of immigration, social support, and gender equality in sustaining vibrant, equitable societies. The U.S. experience underscores the dangers of fragmented policy, the disproportionate burdens on marginalized groups, and the need for intersectional advocacy and evidence-based reform. As the demographic and political stakes of abortion policy continue to rise, the challenge for policymakers, advocates, and communities is to navigate these complexities with a commitment to health, justice, and the dignity of all people. Tables. Here is the text to convert. Table 1, U.S. Fertility and birth outcomes in states with and without abortion bans 2023. Table 2, Economic impact of abortion restrictions by state, selected states 2024. Safe abortion access has been recognized as a fundamental human right by a wide range of international bodies, including the United Nations Human Rights Committee and regional courts such as the European Court of Human Rights, the Inter-American Court of Human Rights, and the African Commission on Human and People's Rights. This principle was reinforced in 1994 at the International Conference on Population and Development in Cairo, where 179 governments endorsed a program of action committing to the prevention of unsafe abortions. In 2015, the United Nations 2030 Agenda for Sustainable Development broadened this commitment by calling for universal access to reproductive health services. The World Health Organization, WHO, first identified unsafe abortion as a public health concern in 1967, and in 2003 it issued technical and policy guidelines urging countries to enact abortion laws that safeguard women's health. According to the United Nations Population Fund, meeting the unmet need for family planning could significantly reduce maternal mortality and cut abortion rates by up to 70% in developing regions. Breaking down the paradox. Global liberalization versus static global rates. Over the past 50 years, more than 60 countries have liberalized abortion laws, expanding access and reducing criminal penalties. Yet the global abortion rate has hovered around 39 per 1,000 women since 1990, despite these reforms. This suggests that legal change alone doesn't drive global abortion trends. Other factors like contraception access, education, and healthcare infrastructure play larger roles. 2. Diverging trends by legal status. In countries where abortion is broadly legal, excluding China and India, abortion rates dropped by 43% between 1990 and 1994 and 2015 and 2019. Council on F. In countries with severe restrictions, abortion rates rose by 12% over the same period. This reveals a counterintuitive dynamic. Restrictive laws correlate with higher abortion rates, not lower. What explains the paradox? A. Access to contraception and reproductive health care. Liberal countries often pair abortion access with comprehensive sex education and family planning services, reducing unintended pregnancies. Restrictive countries frequently lack these supports, leading to higher rates of unintended pregnancies and, paradoxically, more abortions often unsafe. B. Legal restrictions don't eliminate demand. Restrictive laws may drive abortion underground, increasing unsafe procedures without reducing incidence. Women in restrictive settings may resort to self-managed abortions or travel abroad, which aren't always captured in official data. C. Social and economic pressures. In countries with limited social safety nets, economic hardship and stigma can increase the likelihood of abortion, even when legally restricted. Restrictive laws may also delay abortion, pushing procedures later into pregnancy and increasing health risks. Operational implications. This paradox has profound implications for policy design. Legal liberalization alone isn't enough. It must be accompanied by investments in reproductive health infrastructure. Restrictive laws may backfire, increasing unsafe abortions and maternal mortality. Data transparency matters. Countries with liberal laws often have better reporting, while restrictive regimes may underreport or misclassify abortion data. Key insights and paradoxes. Legal access does not equal high abortion rates. Greenland has the highest abortion rate of 84.7 per 1,000, despite broad legal access and moderate gross domestic product. Switzerland, with similar legal access and much higher GDP, has one of the lowest rates of 10.3 per 1,000. This suggests that legal access alone doesn't determine abortion rates, cultural norms, contraception access, and healthcare systems matter more. 2. Restrictive laws don't eliminate abortions. Madagascar and Guinea-Bissau, where abortion is banned or severely restricted, still show high rates of 60.0 and 54.6 per 1,000. These abortions are likely unsafe or unreported, highlighting how legal bans push procedures underground, not away. 3. Economic pressure and reproductive behavior. Countries with low gross domestic product and high cost of living burdens, for example, Madagascar and Guinea-Bissau, show high abortion rates, possibly due to economic hardship and limited access to family planning. The COL to GDP ratio reflects how economically strained individuals are. A more negative ratio, for example, negative 0.0675 in Madagascar, suggests greater financial pressure, which may correlate with higher unintended pregnancies and abortions. 4. Outliers and cultural factors. Poland has a very low abortion rate of 0.7 per 1,000 and highly restrictive laws, but this may reflect underreporting, cross-border procedures, or strong religious and cultural deterrence. India and Vietnam show high rates despite legal access, likely due to population size, urban-rural disparities, and limited contraceptive infrastructure. Operational takeaways. Legal liberalization must be paired with healthcare investment, access to contraception, education, and economic support. Restrictive laws often correlate with higher abortion rates, especially in low-income settings. Cultural and economic contexts shape reproductive behavior more than legal status alone. Assimilation in United States. Immigration policy refers to how immigrants integrate into American society, culturally, economically, and civically. It's shaped by legal frameworks, social expectations, and demographic shifts. Immigration fuels population growth, but assimilation determines long-term cohesion and opportunity. Key assimilation considerations in U.S. Immigration. Cultural integration. Language acquisition is central. English proficiency is often seen as a benchmark of assimilation, influencing employment, education, and civic participation. Civic norms and values such as democratic participation, gender equality, and secular governance are often emphasized in naturalization processes. Multiculturalism versus Americanization. Some policies and public attitudes favor preserving cultural diversity, while others push for rapid Americanization, for example, adopting mainstream norms and shedding ethnic distinctiveness. 2. Economic assimilation. Labor market integration is a key metric. Immigrants who gain employment, upskill, and move into higher-paying sectors are considered economically assimilated. Medicaid and public assistance usage can signal barriers to assimilation, especially in states with limited support for immigrant populations. Generational mobility. Children of immigrants often outperform their parents economically, especially in education and income. 3. Legal and institutional barriers. Naturalization laws often reflect assimilationist ideals. For example, applicants must demonstrate good moral character, knowledge of U.S. history, and allegiance to the Constitution. UCLA Law Review. Exclusionary policies such as bans targeting specific nationalities or religions can hinder assimilation by fostering marginalization and fear. State-level variation. Some states invest in immigrant integration, for example, English as a second language programs, driver's licenses for undocumented residents, while others restrict access to services. Immigration trends and assimilation pressure. Immigration is the primary driver of United States population growth, especially as native birth rates decline. This intensifies the importance of assimilation for long-term stability. Hispanic and Asian populations are growing rapidly, with second-generation immigrants showing strong assimilation indicators, higher education rates, English fluency, and civic engagement. Segmented assimilation theory suggests not all immigrants assimilate equally. Outcomes vary by race, class, and geography. For example, Black and Latino immigrants may face structural barriers that delay or distort assimilation. Emerging debates. Is assimilation still the goal? Some scholars argue for a shift toward integration rather than assimilation, emphasizing mutual adaptation between immigrants and host society. Digital assimilation. Online platforms are reshaping how immigrants connect, learn, and engage with American culture, sometimes bypassing traditional institutions. Political polarization. Assimilation debates are increasingly politicized, with some framing immigration as a threat to national identity, while others highlight its role in revitalizing communities and economies. This report integrates evidence from a wide range of sources, including peer-reviewed studies, government data, think tank analyses, and advocacy materials, to provide a comprehensive and nuanced account of the entanglement of abortion access with demographic and political strategy in the United States and internationally.